Nurse Chris Prutt's knees jump, his heart races, his mouth goes dry and his mind floods with dark memories when he talks about working in the Milwaukee VA Medical Center's intensive care unit, ICU, during pandemic surges. Prutt shares a struggle common to many of the military veterans for whom he has cared for years: symptoms of post-traumatic stress disorder, PTSD. Prutt was among a half-dozen ICU staffers who told Reuters of symptoms such as waking from nightmares bathed in sweat, flashbacks to dying patients during the pandemic's fear-filled early days, flaring anger, and panic at the sound of medical alarms. Those whose symptoms last longer than 1 month and are severe enough to interfere with daily life can be diagnosed with PTSD. The surging Delta variant is heaping on fresh trauma as the United States and other nations begin to study PTSD in health workers. Data already show that U.S. health workers were in crisis before COVID-19. While PTSD is associated with combat, it can arise among civilians after natural disasters, abuse or other trauma. Health workers can be reluctant to equate their experience with that of returning soldiers. Pre-pandemic studies showed that rates of PTSD in frontline health workers varied from 10% to 50%. The suicide rate among doctors was more than twice that of the general public. The American Medical Association, AMA, has tapped a military psychologist and the Department of Veterans Affairs, VA, National Center for PTSD to help it measure the pandemic's impact. Texas Tech University Health Science Center psychiatry resident Dr. Hussein Bayezid and researchers in his native Turkey surveyed 1,833 Turkish health workers last autumn. The results, presented in May at an American Psychiatric Association meeting, showed a PTSD rate of 49.5% among non-physicians and 36% for doctors. Rates of suicidal thoughts increased as workers spent more time on COVID-19 units. Unions want to mitigate trauma by setting national rules for the number of patients under each nurse's care. Workers say they should not have to pay for therapy, medication, and other interventions. The AMA and other groups want more confidentiality for doctors who seek mental health services. Most ICU staff who discussed PTSD with Reuters requested anonymity for fear of repercussions at work. About 5,000 U.S. physicians quit every 2 years due to burnout, said Dr. Christine Sinsky, an AMA vice president. The annual cost is about $4.6 billion, including lost revenue from vacancies and recruitment expenses, she said. Hospital survey results in March led the Department of Health and Human Services to warn staffing shortages have affected patient care, and that exhaustion and trauma have taken a toll on staff's mental health. Trauma surgeon Dr. Carrie George volunteered to work in a Phoenix COVID-19 ward during last winter's surge. She turned down substantially more pay to return to the ICU after the Delta variant surge. George encourages others to prioritize self-preservation, but worries about the loss of expertise. There is infinite value in a nurse who's been working in the ICU for 20 years and just has a gut feeling when something's going wrong with a patient, she said.